but it seems to be spreading. And then our borders were cut off to China and then later to Europe, and it continued to be able to move into the United States, and has obviously moved around the globe, taking a lot of lives, and it's been a very, very difficult season for us as a globe, and certainly as a state and as a nation, to try to deal with. How do we keep each other safe, keep each other healthy at this point, try to be able to put the virus down while we try to find treatments, vaccines, and obviously testing to be able to track this thing directly. So we're going to walk through some of the pieces of legislation, what's happened, what are some of the things the state has done in response to that, and what our status is right now. So I hope this is helpful to you. My goal during this evening is to answer as many questions as fast as we can to try to get through those questions. And so if you're interested in submitting questions, please start submitting those now. And you can submit those through this website. They'll go straight to Dan Potter, and he'll be able to get those questions. We won't see them. Kevin Stitt and I will not see those. They'll just come straight to Dan Potter, and he'll just start feeding them to us as fast as we possibly can. So let me open this up to the governor to be able to make a quick opening statement as well before we get to questions. Thanks for joining us.
Yeah, well, thank you so much, Senator. It's such an honor to be with you. Thanks for inviting us to do this. We always struggle with how to communicate to Oklahomans, and it's such a great opportunity to be able to take questions from folks all across the state with our wonderful senator. So appreciate that. Today I was in Medill while we're dealing with the COVID crisis. Weather continues in Oklahoma, so unfortunately we had a tornado that touched down in southern Oklahoma, and we lost 2 people to that. So I was down there today with our emergency management department, making sure that everybody was safe and offering the resources of the state and kind of touring the damage today. But, my number one goal has been the entire time to protect the health and lives of Oklahomans. That's driven every decision in Oklahoma. And number 2 is to mitigate the impact to our economy and get Oklahomans back to work safely as quickly as possible. So that was what that was the 2 kind of decision tools that we've based everything on. So I'm looking forward to answering the questions on as we move to the next phase of a measured reopening plan in the state of Oklahoma. But Oklahomans have done a really good job up to this point. It's the reason we put over 15 executive orders in place, was to flatten this curve. And Oklahoma's done a great job at this point, and we are really doing that. And so I look forward to kind of getting into the details of what that looks like for the data in our state.
For those of you who are listening to this on my radio station on KRMG, if you would like to submit a question, go to lankford.senate.gov/live and enter it in the chat box right there. Senator Lankford, I'm going to start with a question of my own. Given that the House today approved the Senate-approved package for the Small Business Administration's payroll protection program, another $480 billion, the president says he'll sign it tonight. Those small businesses that haven't yet gotten any assistance, how quickly do you think they'll be able to get it?
So we actually asked the Treasury that question to say how quickly could this turn around. They've not given us an exact date. They said they're going to move as expeditiously as possible. I would recommend to small businesses, they contact their bank or their credit union, their lending institution they typically work with, and say they'd like to go ahead and start the process. Even if they can't enter the data yet, they could fill out the application, which is very short. They could get the basic information about their payroll together, and the banks now have all the details on that. Once what's something called the E-Tran system, it's kind of the behind the scenes. That's when Small Business Administration turns it on. Banks could then submit all that information. That's kind of the last step on it, but you can go ahead and start doing the first steps of it now. So I would encourage you, even tomorrow, to be able to reach out to your banks and credit unions, get in line to be able to do that. This is set up specifically for small businesses, 500 and smaller, and not-for-profits, including faith-based not-for-profits that have been affected by COVID-19. They have to be able to say, I've had a negative effect on this. This is necessary for our business. If they can sign off on that statement to say this helps us function, it'll pay the payroll for 8 weeks for everybody on their payroll. It'll help them a little bit with utilities and lease costs as well to be able to help them get through this. And that's really the target. It's not to try to make businesses whole. It's to try to help us all get through to this, the other side, so we can reopen. So contact your business, your banks about that, or your credit unions, lending institutions, and ask about the Paycheck Protection Program.
Governor, with your phased reopening beginning tomorrow, our first question from Senator Lankford's website is from Beverly, who says, quote, "Why is Governor Kevin Stitt opening businesses? The infection rate is still increasing and we don't have enough testing to find everybody who is sick." That question from Beverly. Governor?
Yeah, well, first off, we are going to base everything on the data here in Oklahoma. So you have to remember, why did we close things down? Why did we go to a safer at home for our most vulnerable population? Why did we sign the 15 executive orders? Three things is what we were trying to accomplish. Number one, we were trying to protect the capacity of all of our hospitals to make sure that our hospitals, our healthcare workers didn't get overrun. We were also trying to build up PPE, and we were trying to flatten the curve. Third, we know that COVID-19 is in the United States. It's in Oklahoma. More people are going to get this virus. Here's what the data says in our state. And I've always said we're going to make decisions on what's happening in Oklahoma, not what's happening on the news or this TV station or in this state, but what's happening in the state of Oklahoma. On March 30th, we had 560 people across the state in hospitals. And at that point, it was starting to climb. I signed my first executive order declaring an emergency on March 15th. So it peaked at 560 on March 30th. Ever since that day, it has had a gradual decrease. Today, in the state of Oklahoma, we have 284 people across the state in hospitals. That is a flattened curve. Then the White House released 4 gates that we needed to meet before we started opening things up. We've met all 4 of those gates. Testing has gone down. About 7% of the people that are being tested are positive for COVID-19. And then the influenza rates are something that has actually also gone down. That's one of the gates that the White House has talked about. At the same time, we have built capacity in our hospitals. Today, with 284 people across the state, we have capacity in our hospitals for 4,600 people. So it is time, based on the data, to start a measured reopening process. So that's why we put together 3 phases, phase 1, 2, and 3, to have a measured approach to start to reopen the economy. And this is what I told Oklahomans. Our healthcare department will continue to monitor all those graphs and all those lines. If anything doesn't remain flat, if it significantly starts ticking up, then we reserve the right to extend any of those phases and to actually even move backwards. Because number one, we're going to protect the health and lives of Oklahomans, but we're also going to mitigate the impact of the Oklahoma economy, and we will measurably get this economy going back again. And now is the time. That's what the data is showing us. And so I think we're taking the right appropriate steps. But again, I'll be monitoring the data daily, and if anything changes, I will let Oklahomans know.
You know that occasionally I'm going to ask a follow-up, and the one that occurs to me here is, how practical is it to think that you can back up and put restrictions back in place if that's necessary?
Well, I mean, obviously, it'd be more difficult. That's why we really waited till we had a good almost month here of a flattening curve. But sure, I mean, obviously, if we see our hospitalizations going up and we're looking like we're going to outpace capacity, then we would obviously have to tighten up. But more likely, we would just continue the phased approach, and we would kick out the phases instead of going to phase 2 or phase 3. We would say, hey, we're going to stay in phase 1 for a longer period of time. But also, this is a personal responsibility. And I've told Oklahomans, we're not out of the woodwork. We have to continue practice social distancing, continue the hand washing, wearing masks when you go into public. And from the very beginning, I did something different than other states. I focused on the vulnerable population. That is those over 65 and those with compromised immune systems. And so we have extended that executive order for safer at home for the most vulnerable populations. And so we encourage them to stay at home, limit their exposure, just go to the pharmacy or the grocery store as needed. But sure, it would be difficult. But we're going to watch the data, and we're going to make those decisions as we see things coming in. But we got to keep reminding ourselves of why we did this and what the curve looks like today.
Our next question really needs both a state and a federal response. I think probably state first. It's from Scott, and it concerns unemployment and the terrible difficulties people are having getting their claims processed and getting checks. Scott says small business unemployment claims being denied because we can't make weekly claims due to not being able to, now denied benefits, bankruptcies coming. Governor, I know that there's issues with the card system that some of the unemployment benefits come on. Have you had discussions with the employment office about the problems?
Yeah, the unemployment department has really been hit pretty hard over the last 6 weeks. We have gone from 1,800 claims would normally be filed in a weekly period to we maxed out at 60,000 claims in the week. I just got a report from that department today that we just approved another 20,000 people. Yesterday, we got 50,000 people. We had to relook at our whole process. We had to staff up for that call center. I'm excited to say we had like a 1% abandonment rate on that call center, which in the call center world is really a good stat. That's been all this week. So we are starting to process those claims, and we're getting them out to the customers the Oklahomans that have lost their job due to no fault of their own.
Senator Lankford, is there anything the federal government can do to help get those unemployment claims processed quicker?
Yeah, processing quicker becomes part of the challenge. Every single state has a different system for unemployment insurance. As you know, that is a state program, that there's a federal partnership with it. So the federal government funds part of it, the state funds part of it, obviously employers fund part of it. So in all of that partnership that happens, everyone has a piece on it. But that also means that's 50 different systems around the country. The particular unemployment insurance is different for this particular program. There's a couple of pieces to it. One is there's an extension to unemployment. If someone was unemployed in September and then their unemployment insurance had run out, this extends them a little bit longer, and so they have that. So that is something the Oklahoma system had to be able to input. How do you be able to extend that a little bit longer? So that's new for them to be able to get in. The second part was there's an additional $600 per week that's given out to individuals that have unemployment insurance. They had to be able to get that into the system. That was a big change. And the largest of the change is the pandemic unemployment assistance. That is to individuals like gig economy folks, whether they work for Uber or Lyft, or they are self-contractors, self-employed. Those individuals typically don't get unemployment. They had to build an entirely new system to be able to put that in. That's what the state is launching out this week. There's no question our state needs to vamp the unemployment system. The Oklahoma Economic Security Commission, the software that they use is from 1987 there. It needs a dramatic update. It's been overlooked for decades in our state. It needs help. And for them to be able to go back and reprogram software from 1987 is not a simple thing to do. So they've aggressively gone after that. They've tried to repair that. But right now it's in the state's hands to be able to get it out. And as you may know, it sounds like you're tracking it starting this week. Those individuals that are self-employed, gig economy folks, they can now for the first time start applying for this, doing the pre-application, and to be able to get through it. So I would say to you, don't lose heart on it, finish it out. We want to be able to provide the assistance, and this assistance will continue on till the end of July to be able to make sure we provide some buffer for folks to get back to their normal employment. But this is the nature of trying to be able to cram something in so different to try to help people as fast as we possibly can. There is some slowdown in the process.
Let's talk a little bit about testing. Number one, there was a second part to Beverly's question earlier about enough testing for everybody who's sick. And then there's antibody testing for the population generally. Governor Stitt, how quickly can we ramp that up? And is that a big part of your phased reopening?
Yes. So the testing, surveillance, tracing is going to be a big part of it. We have added 50 people in our health department to do more tracing, surveillance, testing across the state. I just authorized to test every single person in our nursing homes, 17,500, and our nursing home workers, 24,000, by May 27th. So the next 30 days, we're going to have every single nursing home resident and worker tested. That is where 40% of our deaths in Oklahoma have occurred. And 80% of the people that have died in Oklahoma have been over the age of 65. So I'm really trying to protect that most vulnerable population and really get in the nursing homes to surveillance, test, and then isolate and trace back who's been in contact. So that's going to be a huge priority for us. When it comes to testing overall, we've tested over 50,000 Oklahomans at this point. A little over 50,000 was my report tonight. And we have a little over 3,000 positive. So we have about a 7% positive case. We've stood up over 80 testing sites across the state. And I want to be clear. We want anybody and everybody that has symptoms or think they've been exposed to COVID-19 to get tested. You can call 211. You can go to our health department website, and it will tell you the closest testing site to go get tested. You don't need a doctor's referral. It's a drive-through location. We want you to get tested. We can get them back within 24 hours. So we've set up labs. We've got CLIA to approve our labs. It's a federal requirement to get those up all across the state. So we have plenty of the tests to do that in our state right now. In regards to the antibody testing, what's interesting about that, we have the DLO labs that I know Senator Lankford can give you a little update on. We've got ME Labs out of Norman that has developed an antibody testing. What's significant about antibody testing is it shows people that have been exposed and recovered, they have built up the antibodies to COVID-19, and they may have been asymptomatic. In other words, they never knew they were sick or infected with COVID-19. And some of the early statistical samplings that we've done in Oklahoma show a 1.5% to 2% exposure rate. This was a couple weeks ago, so we think it's even higher now. Some of the stats in New York, in some of the more dense populations, it was 21% of the population was showing antibody positives that they built up. That means they had exposure and didn't even know about it. When you start looking at all the antibodies and how many people had potentially had COVID in the population, it totally changes the numbers. It changes the death rate. It changes how you're going to treat this. The death percentage is the biggest thing it changes. But we're going to continue to do not only the PCR test, but also the antibody test all across the state of Oklahoma as part of our plan to safely and measurably reopen Oklahoma.
Senator Lankford, do you have anything you want to add, especially in regards to antibody testing?
Yeah, let me add to that as well. We have significantly ramped up the testing all across the state and all across the nation. The very first bill that we passed on the federal side dealt with testing and vaccine development. Then the second and third bill, in fact, the one that just passed through the House today, added additional funding dealing with the antibody test. The antibody test is already available in Oklahoma. Now, unlike the test that's to detect whether you have it right now, you don't need a doctor referral for that. You can go to one of the mobile test sites. You can get the test and say, I've been around someone that's had it, or I think I've been around someone that's had it, or I have symptoms. You don't need to be able to get a doctor referral. Right now, you need a doctor referral to be able to get the antibody test, but it's very simple to be able to contact your physician and say, hey, I'd like to be able to get this. They can then refer you to a lab. It is a blood test that's done at that point. They go and check your blood for the antibodies. They can turn that answer around within 24 hours. Our labs in Oklahoma already can do about 2,500 of those a day at this point. And so they're ramped up to be able to do the antibody test. There's no cost for that to be able to get that done, just like it is for the COVID-19 test to be able to find out if you have it now, to be able to find out whether you have had it, and to be able to have the antibody test. There's no cost for that either. That's part of the federal funding that's been kicked in. So if you think you might have had it and you want to be able to get an antibody test, contact your physician, say I'd like a referral to go get a blood drawn, and then to be able to submit that. And within 24 hours, you'll have an answer on that.
Have either of you had a COVID-19 or antibody test?
I have not.
I have not. Yeah, I have not. I haven't shown symptoms. And so again, in the earliest days of this, we were protecting it from everyone that's showing symptoms currently to be able to get it. I never showed symptoms at any point. And so I have not. And then I've also not gone for the antibody test. That actually just came out in Oklahoma this week. And so that's very new to be able to get that.
Cammie wants to know, I want to ask about the $1,200 stimulus payment. I've been on the Get My Payment site 3 times. There is nowhere to put in bank information. All I get is message status unavailable on payment. What Cammie says here, we've been hearing a lot from our listeners, and it's variations on a theme, but everybody that we've talked to is having some sort of problem getting information about their stimulus payment, Senator Lankford.
So here's what happened. Initially, the IRS came out and said those that we have a bank relationship with know where we can deposit it. They were going to deposit those first. About 80 million deposits went out immediately on April the 15th. Since then, the IRS has been chasing. They may have a Social Security number, but they don't know if they meet the threshold for the income requirements, or they don't have information for them, or they're not a filer. If you don't make more than $12,000 a year, you don't file income taxes. So though you have a Social Security number, the IRS has no connection with you. So at irs.gov, there are the two sites up. Sounds like Cammie's very familiar. She's gone there before. One of those sites says just track my economic recovery relief payment. Track that for me. If you punch that in, punch in your Social Security number, your address, and your birth date, it's going to come up and say a status there. It may say we don't have a status. In other words, it's not moving right now. They're working on other things. They don't have your check out, but once they are sending your check, it'll update there and say, hey, it's in process. We're mailing a check to you. That's one option. That is, if you did a return in 2018 or return in 2019, they know what your income was. They know who you are. If you haven't done a return, which are called a non-filer, then you would go to the other portal at irs.gov for non-filers, fill out your information there, turn in your bank information, and say, here's my Social Security number, but I've not been a filer in the past. They'll do the quick study, and then they'll go through the process on it. The checks are going to take longer, obviously. The direct deposit, where the IRS had that relationship already set up, was very, very fast. This is the part that's going slower on it. If you're not getting answers on it, feel free to be able to contact our office just at lankford.senate.gov. You'll see the contact us section there. Click on that, send us an email, or call our staff, and we'll help chase it. We've done this for quite a few people as well, just to be able to check out and see if we can help if something's stuck. The key thing to know is the income requirement. If you make $75,000 or less, you'll get $1,200. If you're a household, married household, two incomes there, that's $150,000 or less. You would each get $1,200. For every $100 you make over that $150,000, that amount drops by $5. So by the time you get to $200,000, it would go away entirely. So there's not any check coming for anyone that has a household income of $200,000 or more. But if you have a household income, two adults with $150,000 or less, you should expect that coming in. Now, if it doesn't, and it's not, we're glad to be able to help chase it. Like I said, we've done this for quite a few other folks already. We're glad to do it, but it will be updated on that site where it's talking about tracking your return. Just when it's mailing it, they're doing batches at a time, getting it all set up, verifying it, and then sending it out. So it is taking a while to get this many millions of people through their system. As you know, the IRS is set to receive checks more than just mailing checks to every American. And so they have flipped the system around, and they're in the process now of actually mailing checks out.
If you've just logged on, welcome to Senator James Lankford's webpage and this virtual statewide town hall with special guest Governor Kevin Stitt. I'm Dan Potter from KRMG in Tulsa. Our next question for the governor from Jeremy. Why is Governor Stitt's office basing its policies for relaxing COVID-19 guidelines and reopening certain businesses on a flawed model criticized by epidemiologists? I think, Governor, he's talking about the IHME evaluation model. I've heard some criticism of it, that it was inaccurate in predicting death rates in some states. Is that, you showed a graphic this week, is that what that was based on? And are you confident that you're using good science and a good model?
Yeah, I mean, we really are. And IHME model is the White House release model. That's one of the models that we use. We also have our own state health department has epidemiologists. We have the University of Oklahoma modelers. And I didn't just use epidemiologists, but I also brought in statisticians. And the University of Oklahoma has done a really good job with weather forecasting. And so we have some great modelers that do hurricane forecasting. And back in March, early March, if you remember, the models were all over the board. If you imagine in a hurricane, you've got some models showing it's going to hit north in New York, and some is going to hit in Florida. And as you get closer to land, that cone of uncertainty starts to narrow. Well, it's the same thing with these models. As you get more testing and more data points, we start narrowing that. So early on, we had the University of Oklahoma, Oklahoma State University, the State Health Department, and then we had all of the White House models and the national models we were looking at, and our folks were putting those together, and it was widely varied. Some of the models showed April 1st, it was going to have 5,000 hospital beds needed in Oklahoma. Some were showing 5,000 hospital beds, but it wasn't going to be needed until August. It was that varied on the graph. And so we started building like crazy capacity and surge plans. And I had the National Guard and the Corps of Engineers working on plans. We set up COVID hospitals in Oklahoma City, Tulsa. We also have set up some non-COVID hospitals to take some flex off of the system in Muskogee and also in Norman. And we built this capacity. And that was the reason we put these executive orders in place. That was the reason we started the social distancing. And so the good news is all of the models started flattening as Oklahoma's cases started to decrease, and our hospitalizations went to 560 March 30th, but then they started going the other direction. And just to remind everyone, as of today, we have 284 people in the hospital being treated for COVID symptoms or positive COVID across the state of Oklahoma. I have hospital beds of 4,600, 15 times what we have in the hospital today. So we feel really good about that initial effort that we're not going to outpace our hospitals or our healthcare workers. And that was our initial response. But we don't just look at one model. I look at all of them, and it's an ensemble of models that I had the team put together for me, and they continue to get better and better over time. But we are looking at the data, and that's why we did a measured response. But the other thing to remember is that COVID-19 is not eradicated out of Oklahoma. It's not eradicated out of the United States. It's still here. We're still going to have people exposed to it. People are still going to get it. So that's why we have to watch those curves and make sure that we don't start going the other direction. But we are going to have a measured reopening of our economy and do it in a very measured way, a very thoughtful way. And we're going to tiptoe into this, and we're going to watch the data every single day. And if anything changes or if any of the trends start moving the other direction, we'll be the first person that backs up or starts extending those phases back out.
Senator Lankford, the model, are you confident in what you just heard the governor say? And are you looking at that same IMHE or IHME model?
It's one model of many that you look at, but it's not the one that I trust in. Obviously, there's a lot of models that are there. Those that are done the earliest are the least reliable in the process. But again, remember, every single state is different. Initially, the models were all nationwide models, and they literally took New York City and what was happening in New York City and multiplied that across the nation. Well, we don't live in Oklahoma like they live in New York City. They're tightly packed with 8 million people all on one small island in Manhattan Island. I mean, so we just don't live the same way and interact the same way that they do. And that's not a negative for them. It just, when they based the initial models, they based it on a giant city like New York City, and the rest of the country is not like that. So the longer we've gone, the more accurate it has become. The goal of this, at the end of it, as the governor said, is that we get our economy get back going again, but we protect the health of individuals. That's why no matter how we reopen, we've got to be able to maintain masks in public. We've got to maintain hand washing. We've got to maintain distancing from each other for an extended season. So just because we reopen around May, what the governor has determined to try to reopen in May the 1st, doesn't mean everybody runs out and is all connecting, shaking hands, seeing each other, sitting together at restaurants. We still can't do that. We can re-engage the economy, but we've got to be able to maintain social distance and to be able to continue to be able to protect the most vulnerable. And the most vulnerable in our community should not come out of their homes, should continue to remain isolated until we get through phase 1 and 2 on this, until we can know for better what's actually happening with the trend lines.
Gary, OKC Gary via Twitter asks, why is Congress, et cetera, being paid and not working when the average citizen's being forced by the government not to work? And Senator, I would throw in a follow-up on that. There was a lot of talk in the first CARES package about a raise for Congress. Do you want to address that as well?
I would love to address that, because that was one of the million bad rumors that happened. There was no raise for Congress in the CARES Act. There were a lot of proposals that were in the House package during that time period that the Senate did not agree to. The Senate actually passed its version, sent that to the House, and the House agreed on it. So there were things like voting changes that the House had demanded to change the way America votes, take away all voter ID, do mail-in balloting without notaries. I mean, there's all kinds of things that they had demanded on that, including a pay raise for members of Congress. We said no to all of those things, but that rumor still persists. Yes, I am still getting paid. I would hope for as many people as possible to still getting paid at this point. That's why we extended the unemployment benefits so that people could maintain that. That's why we created the Paycheck Protection Program so people could continue to still get their paychecks as well. I can assure you, based on your question, you're saying if we're not working, my days start extremely early and go very, very late every day. I spend all day on the phone trying to be able to reach out to people. I am working from home, like most Oklahomans are at this point, other than those frontline folks that are truck drivers, healthcare workers, grocery store, convenience store, all those folks that are in essential businesses right now. They're out. All the rest of us are working from home as much as we possibly can to be able to get this solved.
Okay, so you busted that rumor, and that goes to the next question. Chris wants to know, in the era of fake news, how do we know what sources to trust? Now, that's a big, broad, general question, but right now, trusting the right information is vital. So to both of you, where do you go for good, solid information, and how do you know what sources to trust? Governor, let's start with you.
Well, we've gotten a lot of publicity nationally for being the most transparent state when it comes to COVID-related data. Our health department, from the very beginning, I told our health department, I want to be the most transparent state. We're going to release our testing data. We're going to release our positive cases. We're going to release every single thing every single morning. And so even down to the gloves, the gowns, the face, the N95 masks, we set up through the National Guard. I have them brief me every single night on all of the hospital data. So I'm tracking everything and I'm posting that out there. And then, communicating that to the public is the hard part. I mean, it's frustrating for me as well. We'll have a press conference and we're sharing this data or that data. And then it doesn't seem to sometimes get across in the news, or maybe they change it, or they kind of pull out something that they want to hear, and then they post that. So I love doing things like this, town hall meetings, going directly to the people. I was on radio in Tulsa this morning, just answering questions and telling Oklahomans, the information from a national perspective. I'll let the senator talk about that. But we are constantly in communication with our newspapers, doing press releases. I've been holding probably 3 press conferences a week to give Oklahomans an update on what the curves look like, what the data is, how many deaths we have, how many positive cases, the testing locations, all of that. I want Oklahomans to know we don't want to hide anything from you. We are showing everybody the good, the bad, the ugly, so we can make the right decisions together. And so I hope Oklahomans know me well at this point, that my heart is to, number one, protect the health and lives of Oklahomans. Number 2 is to mitigate the effects to our economy, get our folks working as quickly as possible. And we're going to do that in a safe, measured way. Anyway, so I love just these direct communications with the public, because I think we can get our message out there and we can share the real numbers, the real data. But you can also call our office too if you ever have specific questions, and we follow up with letters and emails, and our staff answers all the questions of our constituents that call in.
Senator, you become kind of an expert on fake news and misinformation. Your thoughts?
So it has become an issue because social media is so riddled with fake news. It is remarkable. Let me go ahead and give you a backup just on the intelligence side of things, what we're seeing happening globally right now. The Russians, the Chinese, and the Iranians are all creating fake information on COVID-19 and what's happening globally, and bringing it specifically to the United States, creating these fake stats, these fake pieces that they can put out, or false stories that they can post in different segments to see if they can get people to repeat it. So I would say on the social media side, go to reliable sources. If it looks like it has ABC, CBS, NBC, whatever it may be, CNN, Fox, MSNBC, don't just trust it on the social media. Actually go to the original site, because there are foreign actors that are absolutely creating fake stories and feeding that into the American system. They are trying to destabilize it. This has been the Russian playbook for a long time, but the Chinese are ticked off because the American government is labeling this not as a Chinese virus, but labeling where it came from and saying there is a responsibility, because the World Health Organization and because China did not get this information out early, the entire world was slow in responding on that. China's ticked off about that, and so they're pushing back. to kind of create this false stir in the United States. So when I talk about getting to reliable stories, get to reliable news sources. Don't just trust what you see on social media. Go check that story out in another source to be able to make sure it's actually accurate. 9 times out of 10, it's not. And one last piece of advice, never trust the headline of a story. A different person writes the headline in newspapers and online media than actually writes the story. And you will be shocked the number of times that you read a headline and then read the story and they seem to be totally different. And many times the writer is embarrassed about the headline because the headline writers are just trying to get clicks, just trying to get people to be able to look at it, but it may or may not line up with the story. But a lot of people on social media will see the headline and think, oh my gosh, that sounds terrible.
How's it going?
But if they actually read the story, it may not be consistent.
Governor, we have a question from Michael who wants to know, why did you decide personal care business with intensive contact between the provider and the client? Why was that, those businesses, why were they included in this first phase?
Well, we had on phase one, it was May 1st for the restaurants, for dine-in restaurants, movie theaters. But on Friday the 24th, we decided to open up some of the personal care businesses, like you said, by appointment only. Because when we saw people going to the grocery store and the pharmacy, to me, it was not a health risk at all with the proper cleaning, the cleaning that they were required to do with masking up, by appointment only, not congregating in their waiting areas. And so that's why we just decided to do that. With the cities that wanted to. And I was very clear that some cities and municipalities have chosen to be a little bit more restrictive, and they wanted to wait until May 1st. I said, that's fine. But you've got to realize that Oklahoma, I'm the governor of all 4 million Oklahomans. So just like I was in Medill today, or Guyman, or McAllister, or Owasso, or Lawton, they have different issues. In Medill, they said they don't have anybody in their whole county that has COVID. So we have 3,000 people that have tested positive. Over 2,000 have already recovered in our state. So I wanted to give some flexibility to start tiptoeing in to the reopening in a very measured response. And I thought that dog grooming by appointment only, or going to get a haircut by appointment only was very reasonable for some of those cities. And again, we will always watch the data. And then on May 1st, the in restaurants would be rolling out the same thing.
Dan from Tulsa wants to know, Dan from Tulsa wants to know, where are you guys getting your hairs cut? Because I'm starting to look like a roadie for Aerosmith, and the two of you look pretty well trimmed up.
Well, come on over to the house, Dan, because my wife cut my hair 3 weeks ago. When I came back from D.C., I was already needing a haircut. But by the time I got home, obviously everything was shut down. And so I couldn't stand it anymore, sat on the back porch on a stool, and my bride, for the first time in our 28-year marriage, cut my hair. And I thought she did a decent enough job. I'm not wearing a hat every day.
That's trust right there. Governor, there was a story out there. Did you have a stylist do your hair?
The story was inaccurate. The lady, let's see here, I was on Fox News, a national Fox News show. And so the makeup artist came and did the makeup before the studio appearance. And she was telling me, hey, I cut the former governor's kid's hair one time. I ought to come and cut your hair. And I was like, okay. And then the next thing I know, it was a story. So I don't know if she posted something that she was going to cut the governor's hair, but she did not come cut my hair.
Okay. All right. Well, you both look pretty good. Moving on. Kathy wants to know, what are we going to do about dental offices not being able to get N95 masks? We're at very high risk for transmission of COVID-19 in dental hygiene, and we cannot find proper masks. Who would like to take that?
You know, I'll jump in first. So I was on the phone with Admiral P this morning, and he's over for President Trump, all of the protective equipment nationally, and making sure that the states have what they need. We have a strategic national stockpile here in Oklahoma, and then all of our hospitals, our surgery centers, our dental offices, our first responders, they're always working on their own supply chain. But I brought in a czar early on, in mid-March or so, late March, I can't remember exactly when I brought him on, Gino DeMarco, to be in charge of collecting the data to tell me exactly what hospitals have, first responders, dental offices, et cetera. And right now, we had a 12.8 day supply of PPE across our state. We are constantly shipping on a daily basis to all the hospitals, the first responders, making sure they have what they need. I shut down in March through executive order any elective surgery, which included non-emergency dental practices. I've lifted that for starting this Friday for those that actually have the PPE that they need. But a dental office, if they're having trouble finding it, they obviously can call our office, the strategic supply, our emergency management center, and we can ship to those dental offices to keep those health workers protected. And but the reason that we suspended the elective surgeries in the first place was to protect PPE for our healthcare and our hospitals. And as we see the supply growing and building, and we have in the supply to treat the 284 folks across the state, then that's why we allowed the elective surgeries to come back. But the first line of defense is always the individual business through their own supply chains, getting their own PPE. But we are also ordering large supplies for our strategic national stockpile here in the state of Oklahoma.
Are you having to compete with other states and the federal government for those masks?
You know, with Admiral P, we got on the phone with him to find out, what the federal response was. They're shipping to certain hotspots, and I just wanted to make sure that Oklahoma was getting our fair share from the federal government. But one thing that Admiral P said that I appreciated, he said, we decided early on when I took over not to go compete in China to go buy and work against all the states. So they've used to let the states get out there and compete against one another. So we are definitely competing against other states and my fellow governors to get access to N95 masks, gowns, et cetera, across the state. So we do compete with them. There is supplies at the federal government, and I'm making sure that we get all of our pro rata portion in our state. And then the other thing is I've challenged manufacturers around Oklahoma to start manufacturing our own PPE to make sure that we can backfill any kind of supply chain disruption. And gowns, right now, we're buying 2,000 gowns a day from a manufacturer here in Oklahoma to backfill that. N95 masks, we don't have those in Oklahoma yet, so we're still having to chase those down. Predominantly, those are manufactured in China, and we're all kind of running after that same supply. We should get more shipments on Monday, Tuesday, Wednesday of next week, according to what Gino told me just tonight. But the N95 are the biggest challenge. I think we've got in several million of the just surgical masks that we constantly ship out across the state to first responders and hospitals. But the N95 masks are the ones that we're still chasing down pretty hard.
Okay, Senator Lankford, how can you help in that? And second part to that question, this really points up why we need manufacturing in this country, doesn't it?
Yes, it does, actually. That's actually what I was thinking the whole time that the governor was talking, is that we really need to focus on more manufacturing here in the United States and the importance of that. There's a lot of lessons that have been learned in this, and I expect there to be a 9/11 type commission that will be formed after this just to be able to compile information. One of those will certainly be the issue of protective equipment, N95, critical minerals. A lot of our prescription drugs are not made in China, but the precursor chemicals used in those prescription drugs are manufactured in China. So we have got to be able to get that manufacturing back here. We learned pretty quickly in January when a lot of our protective equipment for our medical folks, including N95 masks, were produced in China by American companies, then shipped here. But in January, in the height of COVID-19 in China, China just basically took over those facilities and said, you can't ship this out. And so in January, when those things would be shipped by boat from China to the United States to be able to be here by February, to be able to be in warehouses and ready to go out in March, China took those and said, you can't ship those out. You've got to be able to leave them here because we're going to need them in massive numbers. That put the United States behind, that put the rest of the world behind, and it exposed a vulnerability that we have that we better learn the lesson of, that we've got to be able to bring a lot of this manufacturing back home. Now, fortunately, we've got a lot of American manufacturers that have started dialing up, doing more manufacturing here. That needs to be sustained, and it's one of the dialogues of how do we keep that going in the days ahead. Things may cost a little bit more, but if we lose that ability to be able to have something that costs 10 cents more, but we can get it at the time that we need it. We've got to be able to do that and figure out how best to be able to accomplish that. The governor mentioned the national stockpile. My team has been back and forth with the leadership in the United States, talking through with FEMA, talking through with HHS, talking through with all the different leaders that are helping coordinate that national stockpile. I've been in numerous conversations with them, making sure that we're getting it as fast as we possibly can. And they're not holding back on that stockpile. Originally, they were going to try to just farm that out a little bit at a time. And then several of us pushed back and said, no, we've got to be able to get this out to everybody. Let the states be able to manage that so that they'll know what they have to be able to manage. And that's now been released. And the federal government's now slowly trying to rebuild that national stockpile. So if there's a second wave, we'll be prepared again.
Governor Shea wants to know, with the state reopening some businesses on Friday and some cities doing the same, Shea mentions Broken Arrow here. If a business in Broken Arrow chooses to remain temporarily closed for the safety of their employees and customers, will employees no longer receive unemployment beyond Friday the 24th, or will they get benefits until the date they go back to work?
If a business wants to stay closed, that's absolutely their prerogative. There's no need to open back up if they feel that way. So absolutely. And as far as their unemployment, just because we are rolling out May 1st or the 24th for restaurants to be open on May 1st, if a restaurant is closed and somebody's been terminated or laid off from their employment and they are currently on unemployment, they will continue to receive unemployment for that 26 weeks until they go back to work. So it would totally be on that employee going back to work for that employer. But I want to clear something up also, what I said before on the elective dentist procedure. So I don't know if I misspoke or if it was not understood correctly, from our strategic national stockpile here in the state of Oklahoma, we're not going to be shipping to dentists for elective dental procedures. I'm protecting that for our hospitals, for our first responders across the state. And by opening up elective dental procedures or elective surgeries, we expect those private companies to find their own supply chain. We're not going to, at this point, be shipping N95 masks to dentists for those procedures that we consider elective at this point. They're in phase one.
Governor, this question for you from Tim. What will you do if mayors do not follow your reopening plan?
Is Tim trying to cause some controversy here?
Well, we're waiting for Tulsa Mayor G.T. Bynum to announce his plan tomorrow. It may not be in lockstep with yours. Does that matter?
So I've got a great relationship with Mayor Bynum and Mayor Holt in Oklahoma City, and I've been on the phone with the municipalities all across the state. And, I would say 99.5% of the mayors, I believe, are going to be on board on a phase one measured roll-in starting on May 1st. There's a lot of mayors that have come out that have actually re-looked at their proclamations to line up with the 24th with some of the barbershops opening on the 24th. So we'll cross that bridge when we get there. But I've been sharing data with Mayor Holt and Mayor Bynum. We expect them to join the state on May 1st with a very measured response to getting our economy going again. And again, it's data driven. And I will debate anybody that shows me some other stats. But the fact of the matter is, and if anybody's listening, what I want them to remember, we have 284 people in the hospital across the state of Oklahoma. We have built hospital capacity to 4,600 beds. We have adequate PPE, and we have flattened that curve. But COVID is still here in the state of Oklahoma. We're still going to get it. There's still going to be people that are going to get it, so we have to continue social distancing. We've got to continue to protect our most vulnerable population, but we do need to start slowly and measurably reopening. And so that's my message, and I think it's a good message, and I think it's the message that Oklahomans are ready for, a very measured response and a reopening. And I think the mayors will line up, and we'll talk about May 1st If there's other data that points that a mayor can show me that's different in their community, then I'm all ears. We will listen and we'll look at the data and we'll talk about it.
Senator Ian wants to know, do you support Senator Mitch McConnell's position of wariness on additional federal payments to states and localities in Phase 4 legislation? Do most Republican senators also, to your knowledge, feel this way about more money for states and localities in Phase 4?
So what I'd like to see is actually more flexibility for the existing funding that's there. We designated $150 billion to states and municipalities around the country. To give you a perspective on that, Oklahoma's total budget, I think, is somewhere around $12 billion. Obviously, the governor could say what it is exactly. So we're talking about a $1.5 billion allotment that's come to Oklahoma is an enormous number to be able to help. The challenge that we have is I don't think there's enough flexibility in that number to be able to do the things I think the state needs to do. For instance, there's a challenge to be able to note everything that is COVID related, which there's a lot. Unemployment is COVID related, and so the offset for unemployment costs to the state is very significant. There's obviously lots of costs for setting up some of the hospitals, National Guard work. There's lots of things that are there. But there's also going to be some missing revenue and other things that are there. Currently, that's not allowed under the statute. I'd like to give more flexibility to the states and municipalities and to be able to help cover that. Oklahoma is unique in that our municipalities are dependent on sales tax. No other state does that. And so we're very vulnerable to something like what we're experiencing right now. And so I'm trying to be able to work towards greater flexibility on the dollars we already have. Now, there's been a lot of conversation about a Phase 4, a next big package that's coming out. Quite frankly, the challenge that we're looking at right now is what is needed, what was missed in the first phases that we need to be able to address more of. This is not all about making everybody whole. We can't make every business whole. We can't make every family whole. Can't make every city and state whole. The federal government is not being made whole in this. This is a global pandemic that we're experiencing, and it has dramatic effects economically around the entire globe. And so we can't borrow from each other, basically, is what we're doing right now. And to continue to be able to do that over and over again and think there's no long-term effect, or we're going to send enough money to every state that every state doesn't have any debt, but the federal government drowns in the debt, and then we as a nation become weaker and weaker. So we've got to be able to balance that. This is a $2.5 trillion set of bills that just came out in the last month. $2.5 trillion. To give you a picture of that, the total budget for the entire federal government, for every entity, national defense, education, health, Social Security, everything that we do is $4.5 trillion. So we've spent in a month what we typically spend in 12 months, and we still have the rest of the year to be able to go through. So we need to be attentive to what we're spending and not have an expectation the federal government is going to just print money and have unlimited debt, but states are going to have no challenges. We are all going to have challenges as we walk through this. Every family, every business, every state, municipality, and the federal government will all have consequences, and we just got to be able to find a way to be able to balance this out together. But in the meantime, $150 billion to the state, to all states, including $1.5 billion just to the state of Oklahoma, help walk through this is a significant amount of money to be able to walk through this together.
I think we have time for one more question before we start wrapping the hour up, and it's from Nita in Stillwater, who says, rural hospitals have been hit very hard. Some have closed, others are in danger of closing. Senator, Governor, what can the two of you do to keep medicine in rural communities?
So let me start that out real quick, and I'll pass that over to the governor as well. This has been a project that's been an ongoing issue for me for quite a while. It may surprise some folks that are tuning in tonight that this is an area where I've partnered in the Senate with a gentleman named Dick Durbin, who's a Democratic senator from Illinois. They have a lot of rural hospitals in Illinois that have some of the same challenges that we have in rural Oklahoma. So Dick and I actually have a bill together working on repayment schedules for rural hospitals because that has to be increased. We're changing the way they do what's called critical access hospitals and other designations to make sure our repayment is there. We've had several proposals on Medicaid because a lot of our rural hospitals are very dependent on not just Medicare, but Medicaid as well. And so we have multiple proposals on that. So we are actively working legislatively on that. In the CARES Act, it changed the reimbursement formula during this time period for Medicaid to be able to help in that way, because that's a significant help to not only our rural hospitals, but most often to our rural nursing homes as well, that are very exposed during this time period. So that increase has happened. We've allotted $175 billion towards hospitals, nursing homes, clinics, specialty hospitals, all of those. If they're a Medicare or Medicaid provider or supplier, they're eligible for this $175 billion. Just think about what an enormous number that is. Those dollars have already started being released out. Many hospitals have already received those here in Oklahoma. There's another allotment that's coming out actually this week, and there'll be another one coming up 2 weeks after that. So there's quite a bit of money that's coming to be able to help stabilize this. We have to be able to have functioning hospitals. And as the governor mentioned before, we've got well over 4,000 beds across the state that are empty right now, that are ready to go for COVID cases that are not coming. But that's lost revenue to all of those hospitals. And that's very significant for every lab, every hospital. You would think that all of our hospitals are doing great economically right now, but they are not. Folks are not using the emergency room right now because they're leaving that protected for COVID patients. They're not in our hospitals and using other resources because they're protecting that for others. That's a good thing to be able to do as we live out this basic principle of love your neighbor. That's a good thing to do, but for our hospitals, they've got to survive this, and at the end of it, we've got to have thriving rural and urban hospitals. So that is something actively we are working on. We put dollars to that in the CARES Act. We renewed that again this week in the bill that actually the Senate passed 2 days ago, the House passed today. We'll continue to find ways to be able to support them, not only in the short term, but in the long term as well. And that's what Dick Durbin and I are working on, is trying to be able to get that. In fact, we tried to get it into the CARES Act, the piece that he and I have been working on for a while. We're not able to get that into it to get enough agreement between the two of us to be able to get it in. We agreed, he and I agreed, trying to get the rest of our 98 colleagues on board with it. But we'll continue to be able to press until we get this done.
Governor.
Yeah, the only thing I would add is, like the senator said, with our hospitals, rural hospitals specifically, really struggling financially, especially during the COVID crisis, because the patients aren't there right now. That was one of the reasons that last week I lifted the elective surgery ban in our state. So because a lot of the rural hospitals, that's where their revenue comes from, is some of those elective surgeries. And we stopped those to prepare for the surge, protect PPE, and now with the data showing that we're in a good spot to protect Oklahomans as a whole, I wanted to lift that and get that elective surgeries back going. So that was one thing practically we did. And then the things that Senator Lankford talked about from the federal level, there are some resources coming to our rural hospitals to help Oklahomans.
Time to wrap up the hour. Thanks to all Oklahomans for their questions. Governor, you're our special guest for this. The ball is yours to wrap it up.
Well, I just want to thanks so much, first off, Senator, for allowing me to be on the call and speak directly to Oklahomans. It's such an honor. And then thank you to Dan Potter. Love being on your show live there in Tulsa. So have me back on anytime. And then we've got the message to Oklahomans is there's light at the end of the tunnel. What we've done this whole month of April has really flattened the curve. And like I said in earlier press conferences, the better job we do of social distancing and taking this seriously and letting our employees work from home and keeping our most vulnerable at home and limiting their trips to the grocery store, the better and quicker we're going to be able to get back to life in May. And I said that really in late March and early April, and Oklahomans have done a great job. I specifically want to thank our healthcare workers. They've been on the front lines, putting their lives at risk for the benefit of our entire state. So our nurses, our doctors, they have done a fantastic job. The first responders, I just want to thank them for what they've done to take care of Oklahomans. And then also want to thank our National Guard. I literally could not be collecting the data and doing the things without our National Guard. So we called them up when I declared the emergency. I have them strategically placed around the state in the hospitals, collecting real-time data for us so we can make good, accurate decisions. I've also deployed the National Guard to our nursing homes to do deep cleaning. I've got 11 teams around testing, tracing, and also helping clean our nursing homes for our most vulnerable population. Testing sites, they've done a great job of helping with testing sites in our 80 locations across the state, kind of handling traffic flow. So they've done a really, really good job, and I just want to publicly thank them and let you know, Oklahomans, that there is light at the end of the tunnel, and it's getting brighter, but we're not out of the woods yet. So we are going to measurably start reopening, And thanks to all the municipalities for following our lead. And we're going to do this safely and measurably.
Senator.
Dan, thanks. Thanks for being here. Governor, thanks for being on, help answering questions. You and I are both answering questions from a lot of folks throughout the course of the day. It's good to be able to do it together, to be able to go through both state and federal issues. Let me join the governor in saying thank you to healthcare workers that have worked amazing hours and very long days, and their families have been very worried about them. And there's been lots of risk. We've got lots of law enforcement that are out there, that they're also on those front lines, grocery store folks that are doing carry-out food, folks that are in convenience stores. We've got a lot of people that just kept the economy going, whether it be truck drivers or folks in the oil field, because the oil wells don't just stop. You can't just turn them off. You got to continue to be able to maintain. So those folks that have done the essential work during this time period, that have really faced a sense of uncertainty for them as they've stepped out, and others have been in their homes trying to be able to protect other people. Thanks for doing that. Thanks for loving your neighbor and serving people the way that you are. And we look forward in the days ahead, once we get through phase 1, phase 2, and phase 3, to wrapping our arms around you and giving you a hug and personally saying thank you to you once we get on the far side of this, because you've done really remarkable work to be able to serve people, very often that were total strangers. So thanks for serving people and honoring each other the way that you have. For Oklahomans, we know how to be able to get through a storm. We've done that the last 24 hours with a physical storm. This is just a very different type of storm right now that we're going through. So continue to be able to watch out for the most vulnerable. Even when we get to May 1st and on, we've still got to watch out for those folks that are going to be shut in, those folks that are highest risk, that are diabetics, those folks that have heart issues, those folks that are older, that really need to still be protected, need to stay in their home. They're going to continue to need folks to be able to bring them groceries. They're going to continue to be able to need some help. And so mow their yard, help them find ways to be able to serve other folks. But at this point, continue to be able to protect those folks, because they've got several more weeks to go, that we got to continue to be able to protect our most vulnerable in this. We have lots of folks that have reached out and asked us questions. We want to be able to help on that. Whether you're a small business working with the Paycheck Protection Program and you have questions, whether you're working through the economic injury disaster loans through the Small Business Administration, whether it's one of the other loan programs for businesses, or as we mentioned before, the economic relief payments, those checks that are coming out to folks. If you've got questions, go to our website, hit the contact us section there. You can email us there, or you can call our office, and we are glad to be able to chase it down. All of my staff that's both in DC working from home and in Oklahoma working from home, all of us are focused on answering constituent issues right now, trying to be able to work through issues with regulators or with agencies to be able to get answers to issues that are happening, both on the state level in individual businesses and for individuals. We want to help in every way we can. So please let us know what we can do to be able to come alongside you. If you have a question that we didn't get to tonight, hang on. We'll try to contact you within the next week. You put that down in the chat box. You probably gave us your email address or a phone number. If you gave us one of those within the next week, we will get back to you and be able to answer that question to make sure every person that had a question tonight gets an answer to their question in the days ahead. If you have a question that you didn't ask, go to the Contact Me section here on this website right now at lankford.senate.gov and just hit an email there, send an email to us, and we will follow up in the days ahead. And if there's any way we can get information out to you, please let us know, because we want to be able to help. This is a time when we're living our faith and working and serving each other, but it's also a time that we can't lose hope, that our faith gives us tremendous hope, that there is a God who is bigger than us, who's bigger than COVID-19, and we do understand there's a purpose that's bigger than all of this that's going on. And so we continue to serve, we continue to take care of each other, and we continue to live with a sense of hope, because it is not all lost, though it is very difficult in this season. And I look forward to the day, decades from now, when we're sitting around with our kids and grandkids telling the story of what it was like during COVID-19 and saying it was tough, but we got through it, and we will. Dan, thanks again.
Senator, thank you. Governor, thank you. And to everybody who submitted questions and viewed this evening, thank you. The last thing I would add to the both of you, and you get this public, Oklahomans, trust you. And we followed your advice. We shut down, we separated, and now we're going to trust you and go back to work. Please continue to exercise good wisdom, good judgment, and good conscience, and the best data you can. And thank you for this evening. I'm Dan Potter, 102.